Okay, I'm going to put my top into my lubricant, and I'm going to go ahead and I'm going to attach my syringe. At that point, I can go ahead and I can move this box over here, still maintaining sterile field, and I'm going to get these closer. At this point, I can take my hand and I'm going to go ahead and I'm going to place it onto the patient. I'm going to reach over with my swabs and I'm going to start down the side. I'm going to throw it. We're going to go the other side. Throw it. And then we're going to go right down the middle. And same thing, we're going to throw it. I'm going to go ahead and I'm going to grab the catheter. I really like the one technique where she was able to like roll it. Like, that was super helpful. And then I'm going to have my patient breathe out as I insert. Okay, as soon as I start to see urine, I'm going to go ahead and I'm going to push in just a little bit further. And then I'm going to take my non-sterile hand, I'm going to reach over and I'm going to touch my thing. I'm going to take this here, I'm going to also bring it up to my non-sterile hand. And I'm going to go ahead and insert those 10 cc's into that catheter, nice and slow. Okay, remove that. We're going to go ahead and hang your bag, keeping it below my patient's bladder. And I'm going to go ahead and I'm going to put a stat lock on the patient as well. If for some reason I get more than 750 to 11 or 1,000 mLs, I'm going to see what my the policy is for the facility that I work at and what I'm supposed to do. I'm going to pretend that the stat lock is thing. I'm going to go ahead and take the sterile gloves off.
You never want to leave the
I'm going to
sterile field outside and you also don't want to leave too far the patients in there.
clean everything up,
Right around.
cover up my patient, educate them on signs and symptoms of infection, what the urine should look like. When I go back to document, I'm also going to document the color of the urine, how much output there was, things like that. Okay. We're going to continue on to the removal of the catheter. So I'm going to remove my sterile gloves because I won't need those anymore. All of this has been cleaned up and is gone. When I come into my room, I'm going to introduce myself, hand hygiene, presentation about what we're going to do. For the removal of the catheter, the only thing that I'm going to need is my sterile syringe. I'm going to go ahead and attach it. I'm going to go ahead and withdraw. That's great. It's empty. It's empty. I'm going to go ahead and attach it. And then we're going to go ahead and we're going to slowly withdraw those 10 milliliters. Okay, I can at that point squirt that out into the garbage and go back and see if there's more there, since I didn't put the catheter in, or I may not have put it in. I don't know exactly how much is in there, so I always want to make sure I'm careful. If you wanted, you could have your patient breathe out, and you're just going to go ahead and pull it out, being very careful not to make a mess. At that point, you could remove all of this. You could note how much output you had. You're going to go ahead and dispose of everything. I would probably change my gloves, and I would perform pericare, making sure that my patient was clean and comfortable. And then I would position them, lower the bed back down, put their head up, whatever it is that they wanted to be comfortable.
There is another pad.
There we go.